Apollo Cradle, Koramangala.
A hearty good afternoon to everyone, and welcome to a session on cervical cancer screening and vaccines. We are pleased to have Dr. Vijaya Manohar among us today to help us to understand the topic. Regular screening has been shown to prevent cervical cancer and save lives, and the HPV and Pap tests help find cervical cancer early, and that early screening can help treat any issues before they become life-threatening. So, doctor is here to help us on this topic. Doctor, you have the stage.
Okay. So the cancer cervix is the most common, second common in the female. Then the most common, it is caused by human papilloma virus. This human papilloma virus is acquired through the sexual contact, and this papilloma virus, HPV virus, it can affect the other organs like vulva, vagina, and anal region and oral cancers also it can cause. The coming to symptoms, they usually come with abnormal menstruation, like heavy menstrual flow and bleeding in between the periods, and bleeding after the sexual contact, and bleeding after the menopause. And other symptoms like they may come with a foul smelling discharge, watery and sometimes mixed with blood, and other symptoms like lower abdominal pain, severe backache. Then some cases they come with unexplained weight loss, fatigability. These are the common symptoms. Bleeding in between the periods and heavy flow. And we want to know who are at risk for developing cancer cervix. The people who have an early sexual activity, multiple sexual partners, any history of sexually transmitted infection like chlamydia, gonorrhea, they are more prone for developing this cancer cervix. And other like immunocompromised individuals are also at risk of developing. Those who are on a prolonged usage of pills, and if there is any family history of mother and sister, they are also more at risk of developing cancer cervix. The main important screening tests are, we have a pap smear test and HPV test. Pap smear test should be done every 3 years. It is a simple screening procedure. Through a speculum examination, we take the vaginal and cervical smear to look for normal and abnormal cells. And this HPV test is also done, which needs to be screened all female between 21 to 45 years every 5 years. So pap smear every 3 years and HPV test. These are all the early detection. We can detect any abnormal cells and HPV infection. And coming to the prevention, whoever is having the treatment of sexually transmitted infection and use of barrier method, which will also prevent the HPV virus infection and improve the immune status of the individual so that the immunocompromise can be overcome. And also mainly the prevention can be done through a proper screening as well as by vaccination. So cancer cervix is one thing which can be detected early, and we have the only cancer which can be prevented by vaccination. And coming to the vaccination, vaccination, we have three types of vaccine, that is Cervarix, Gardasil, and Gardasil 9. The Cervarix is given in a 3 dosage schedule, 0, 1, and 5, and whereas Gardasil is given 0, 2, and 6. That is, first dose is given, and then second dose will be after 2 months. The third dose will be given after 6 months. Gardasil 9 has come. That is very good for it is cover all the 9 types of HPV virus. There are 200 types. This Cervarix will cover 16 and 18, which is the most high risk HPV viral infection. Whereas this Gardasil covers even the 16, 18, 6, and 11 types, which will cover the genital warts also. And Gardasil 9 will cover all the 9 types of HPV virus. And it is recommended, the vaccination is most important. It is recommended in a young age from 9 to 14 years, 2 doses only, 0, and then the second dose will be given after 6 months. And others, it is given whoever the contraindication to give the vaccination, that is suspected pregnancy. And suppose there is pregnancy, if she is already pregnant, and it will be better to defer the subsequent doses. And those who are on HPV vaccination also need to do a pap smear every 3 years. If there is a high risk case, then depending upon the this thing, no, vaccination should be continued. It is a very important to prevent the cervical cancer because it is a preventable one. Where it is the only cancer which is preventable by vaccination. So early detection, especially 9 to 11 14 years, 2 doses, and we have to give the minor side effects, like usually no side effect with vaccination. Minor side effect, they have the local reaction, soreness, pain, swelling at the injection site. Systemic, very rare, you may have a nausea, vomiting, giddiness, and since there is no major risk with the vaccination, the best we can prevent the cervical cancer by proper screening as well as by vaccinating. So there will be 70% prevention of cancer and 90% prevention of cancer plus what, and 100% prevention if we start early by vaccinating as early as 9 to 14 years. So cancer cervix is the one which causes a lot of maternal mortality, and it is a second most common cancer in the female. So early detection, proper screening, proper vaccination, thereby we can early treat the women, and so that she can have a happy and a healthy life by vaccinating. And early detection by HPV and Pap smear test. Any questions? Suppose any pap smear and every 3 years and colposcopy has to be done. If there is any abnormal cells, no, sometimes colposcopy has to be done. That is nothing but magnifying the cervix and seeing in case any abnormal symptoms, abnormal spots over the cervix. So that may need a cervical biopsy to confirm. So these are all the important screening tests like pap test and HPV test, followed by colposcopy if there is suspicion regarding the abnormal areas. ಒಂದಾಯ್ತಲ್ಲ ಸ್ಟಾಪ್ ಓವರ್. ಸೊ ವ್ಯಾಕ್ಸಿನೇಷನ್ ಇನ್ನೊಂದ್ಸಲ ಮಾಡ್ಬೋದಾ ಅಂತ. ನಾ ಮಾತಾಡಲ್ಲ ನಾನೇ. ಫೋನ್ ಬಿಡಬೇಕು. Any questions, please? There's a question on the screen ಅಂತಾರೆ. So up to 45 years we can give the vaccination. So normally it is ideally 9 to 15. From 15 to 45 we can give 3 doses. Up to 30 years, 3 doses can be given. And after 30 to 45 years, though it is less effective, it can be given till 45 years. So both the test and vaccine can go together. Though you're on test, no cervical vaccine, cervical cancer test doing, they can also go for the vaccination. No more questions. No more questions left, doctor. We can end now if you like. Since the cancer cervix can be do a proper screening as well as we can go for vaccination, it is preventable. So please, it should be made a compulsory, like 9 to 14 years, the 2 doses of vaccine, and from 15 to 30, 3 doses, and up to 45 years, definitely it is useful. So thereby, by proper screening and vaccination, we can control the incidence of cancer cervix, and thereby the women can have a early detection, proper treatment, and can have a happy and a healthy life. Uh,